Well, welcome everybody. My name's Ross Hauser. I'm a medical doctor that specializes in prolotherapy. I'm very grateful that you're here. We're live. I'm coming to you from Fort Myers, Florida, at Caring Medical Florida facility. We're actually in my office. I'm here with Izzy and Ben, who are part of the media team here at Caring Medical. I'd also like to thank other people in our media team, including Barry, our publicist, Nicole and Travis, who've worked very hard to come up with really good graphics that will explain why the vagus nerve is getting injured in so many people. Today's talk for 2 hours on the vagus nerve is actually only the first part of the webinars that I plan to do. So what I'm going to do is do 6 hours of talks on the vagus nerve. This is going to be the first talk, which will encompass 2 hours, where we're going to talk about the vagus nerve basic function and pathology. Like a lot of the talks I do, I really encourage people to write down key points. So there might be times today where I ask you just to write down a key point. And the reason for that is we're all spending the time here together because we think it's significant. And honestly, there's a lot of lives at stake. Like, I'm confident that listening to me today are going to be people who are basically hopeless. And I hope by the end of this talk, you'll understand what's causing your condition and then get help for it. The vagus nerve is basically involved in almost every disease that people have that is chronic. So every chronic disease, and I'm talking about heart disease, arrhythmia, mental fog, dizziness, vertigo, chronic digestive problems, leaky gut, gastroparesis, speech problems, swallowing difficulties, all these disorders, if you follow the neurology of it, the neurology goes right to the vagus nerve. And then if you follow why is the vagus nerve getting injured, that's going to lead you right to the neck. So most vagus nerve problems that have a structural cause, the cause is the neck. Next. As I said, my name's Dr. Ross Hauser. Please feel free to email me any questions or cases that you might have. So we're always happy to review cases. So if you wonder if you're a candidate for prolotherapy or you have questions about this webinar, please feel free to email me at drhauser@caringmedical.com. Every day in the office here, we see people from around the globe. My last patient of the day was from New Brunswick, Canada. And sure enough, the person, when it was a new patient, he had a deviated uvula. So absolutely his right vagus nerve was a problem. And we did a test that we do in the office here, a digital motion x-ray. And sure enough, he had upper cervical instability. So the prognosis for him getting better with prolotherapy is excellent. Next. I should say I wrote a lot of books. Some of the books have been translated into various languages. This is Prolo Your Pain Away. This is the Korean edition. We have available for free as an ebook, Curing Chronic Pain with Prolotherapy. So I'd really encourage people to go to our website and download the free book, the free ebook, Curing Chronic Pain with Prolotherapy. For those who like history, this book is Ligament and Tendon Relaxation Treatment by Prolotherapy. This is actually Dr. Hackett's original book on prolotherapy. So that's a very interesting read. I run Caring Medical with my wife, Marion. She's our CEO. Most of you know I've been doing prolotherapy for almost 30 years, written 9 books on prolotherapy, and we have over 30 scientific papers on prolotherapy. With Ben and the media team, we're trying to finish up the book that we just recently finished called Joint Instability, the Missing Diagnosis. In that book is a 400-page section just on the vagus nerve. The various slides that you'll see are actually figures that will be in that book. Next. I'm coming to you from the Hauser Neck Center here in Caring Medical, Florida. We see very complicated neck patients from all over the globe, and we're always happy to review your case. So if you have any questions, please contact my office at caringmedical.com. The vagus nerve is vagus stands for wandering, so that's what the word vagus means, is wandering. The longest nerve and the most important nerves in the body are the vagus nerves. There's the vagus nerve, there's one on the right side of the neck and one on the left side of the neck. The vagus nerve innervates all the organs in the abdomen. So the vagus nerve innervates the heart, innervates the lungs, innervates the liver, pancreas, spleen, stomach, kidneys, all these things. The vagus nerve has projections into the brain. So the vagus nerve basically has a say-so in the functioning of everything in the human body. So if a person's vagus nerves are not functioning correctly, it could affect the brain, the brainstem, all the organs of the body, and those things can start to degenerate and get disease. So I think the neurology of most diseases, in other words, and hopefully we'll get questions during this webinar, so feel free to ask me questions during this webinar. I think if you follow the neurology of every chronic disease, you're going to see that the cause of that chronic disease involves the vagus nerve, or at least the propagation of the disease involves the vagus nerve. So if people can get their vagus nerves functioning better, then that disease can either be cured or the disease can be helped quite a bit. Next. When somebody has high vagal tone, so what we mean by high vagal tone means that both vagus nerves are functioning optimally. So the overall physiology of such a person is regenerative and anabolic, meaning when your vagus nerves are strong, you have a great capacity to regenerate or heal or grow tissue. Generally, those people, their testosterone levels are high, their cortisol levels, which is one of the stress hormones, they're low. They get very good sleep. The person is a very calm, peaceful person. The vagus nerve is basically the nerve that slows the body down and gives the body calmness. The vagus nerve, when stimulated, it lowers the heart rate. So when people have healthy vagus nerves, typically their pulse rate is low. So there's days in the office where I have patients in every room, very complicated patients, and when we check my pulse, it's like 58. So even in the midst of having very complicated patients, my heart rate is very low, so that would mean my vagal tone is very good. When your vagal tone is high, your heart rate variability is going to be very high. And that's the main monitor that you can use and we can use for vagal tone, called heart rate variability, and we're going to talk about that later in the talk. When your vagus nerve is functioning well, you have a great ability to problem solve, and your brain seems to be on high alert, and you have very good senses. You can problem solve very good. Your cognitive function is very high. When your vagus nerves are degenerated, when there isn't as many vagal neurons as normal, and we'll talk about that later in this talk. When you have low vagal tone, in other words, the nerve impulses in your vagus nerves are not getting through. There's something slowing the vagus input. There's something stopping vagal nerve impulses from going through to the brain, to the various organs. then the organs can start degenerating. The physiology of the body becomes inflammatory. So if you feel like you have inflammation all over your body, you have body pain, people touch you and right away you have a sensitivity, you're hypersensitive to palpation, you most likely have degeneration of one or both vagal nerves. When the body has a lot of inflammation from vagus nerve degeneration, cortisol levels are high, testosterone levels are low, sleep is terrible. The person has a structural anxiety. If you have anxiety and you don't know why you have that anxiety, nobody can figure it out, probably you have vagus nerve degeneration. I was talking to a patient last night and they have episodes of doom. Like they feel like something bad's going to happen. They get trembling. If this is happening to you, most likely you have low vagal tone. When you do get a stressor, like, we all get under stress. When your vagal tone is high, you could have a major stressor, but you recover really quickly. Or you don't go crazy, like you don't get on edge. When you have low vagal tone, even a little stressor, your mother-in-law calling you, you have a little disagreement with a coworker and you go ballistic. Well, you have a little stressor and you're making a mountain out of a molehill. It could be that you have a structural vagus nerve problem. Next. When you have vibrant health, you have really good energy. Your brain function is amazing. You can handle 10 things at once. You have really high vagal tone. So the vagal tone correlates with how much you can accomplish in life, how healthy you are. When your vagal tone is very low, it's very easy to get disease. It's very easy to get stressed, and you struggle in life. You struggle with your health. You struggle in life. Next. Now, these are things I'd like you to write down. So if you could write this down. If you are chronically sick, most likely you have a vagal nerve problem and a structural neck problem. If your child is chronically sick, they most likely have a vagus nerve problem and a structural neck problem. Okay, so what does this mean? Let's be honest. I don't have my cell phone here, but let's imagine I have my cell phone and I look down. When a person looks down, watch how the vertebrae, see how the vertebrae separate? So that's what looking down looks like in your vertebrae. These spaces right here, those are ligaments that are getting stretched. Children are supposed to be looking up. When a child is crawling, like Izzy, who's here, how old's Lainey?
Oh, she's only 12 weeks.
Well, Lainey's 12 weeks and Max is how?
He's over 1.
1 year old. So she has 2 young children. And I guarantee you those children, they're looking up. Who are they looking up? They're looking up to her. So children are supposed to be looking up. When you're looking up, you have a nice cervical curve. You have a nice cervical curve when you're looking up. So children and us, we're supposed to be looking up. We aren't supposed to be looking down at cell phones. We aren't supposed to be looking down at tablets or looking down at the computer for hours and hours. When you do that, you stretch out the ligaments. Once you stretch out the ligaments, then the vertebrae go into positions that they're not supposed to, and that can then cause a compression, a tearing, a torsion, a rotation, a compression, an impingement of vital structures such as the spinal cord, such as cranial nerves, and especially the vagus nerve. So the structural cause of vagus nerve degeneration is cervical instability. And we're going to talk a lot more about that today. The etiology of almost all chronic diseases dead end at the vagus nerve. So I'm talking about heart disease, endocrine disease, nausea, poor digestion, infertility, colitis, even cancer and dementia and Parkinson's. If you look at cancer and you type in on Google cancer and autonomic nervous system, you'll be shocked at like the stuff you find. The vagus nerve is at the crossroads of the brain-body interaction. What does that mean? So in other words, all the stresses that you undergo in a day, that stress can come from foods you eat, chemicals you ingest, conversations you have, even thoughts you have. The sensor of all those stresses, the sensor that's telling the brain and the body what to do, is the vagus nerve. So the vagus nerve is what shuts off or controls body stresses. And when the vagus nerve doesn't function good, the body then starts to degenerate and get disease. And a lot of ways that's manifested by systemic inflammation. Next.
No, sorry.
Next. Now this slide has a lot of things. I'm sure many of you have seen holistic providers. Anybody who's seen a holistic provider and the holistic provider said you had leaky gut, right? They say you have leaky gut. What's the leaky gut caused by? And they tell you you have food sensitivities or you have food allergies. I'm not denying that food allergies can cause the tight junctions in your digestive tract to open. So now the body gets exposed to substances in foods or food particles that it shouldn't. That can come from food allergies, but the primary sensor in the digestive tract is the vagus nerve. The vagus nerve interacts with a lot of things in the digestive tract, and if the vagus nerve is degenerated, then the tight junction of the digestive tract open, and the body gets flooded with things which cause systemic inflammation. It's also the vagus nerve that controls inflammation in the body. So that would be another thing to write down. The vagus nerve shuts off inflammation in the body. So if you have sensitivity to touch, palpation, body pain, if you've been diagnosed with any kind of neuropathy, especially small fiber neuropathy, most likely you have vagus nerve injury, vagus nerve compression, vagus nerve degeneration. The vagus nerve causes anti-inflammatory substances to be released in the body, and that it does it through the digestive tract and through the spleen. Next. You got to think of the digestive tract as like Fort Knox. In other words, think about what puts the body's health at risk. It would be if you breathe something that was dangerous because that's going inside the body, or it's something that you eat. So in other words, the easiest way for the body to get sick is your friend has the flu and they cough on you, and then that gets ingested into the body, or there's bad things in the food you're eating like bacteria or chemicals, right? There's a lot of food that has chemical in it. So how does the body protect itself from invaders? Well, the first thing it does is the digestive tract has these tight junctions, so things can't pass through the digestive tract easy. The sensor for that, the main sensor that tells the brain what's going on in your lungs and your digestive tract, is the vagus nerve. So when the vagus nerve is not working correctly, substances get into your system that shouldn't, and then the body mounts an inflammatory reaction. And if your vagus nerves aren't working right, then the vagus nerve can't shut off the inflammation. This is another thing that shows that your intestinal permeability increases when you have vagus nerve degeneration. So again, anybody who has digestive problems, somebody might have ulcerative colitis, they might have Crohn's disease or leaky gut. If you have those things and you got on a healthy diet, maybe a vegetarian diet or a gluten-free diet, dairy-free diet, and it didn't really resolve the issue, you probably have vagus nerve degeneration. Okay, we have a question.
Yes, Dr. Hauser, we have a question from Facebook. Can ozone therapy help vagus nerve degeneration?
Can ozone therapy help vagus nerve degeneration? Well, when you do ozone in the blood, that's called major autohemotherapy. That helps purify the blood. In other words, if you want to help the vagus nerve directly, you have to inject in and around the vagus nerve, and you have to resolve what's causing the vagus nerve issue. So normally that would mean that you have to do treatments directed at prolotherapy in the neck. One of the proliferants that doctors use is ozone. So if somebody went to a skilled prolotherapist and they treated where the instability is in the neck, then they could use ozone as a proliferant. Next. All roads lead to Rome, right? So Ben did this illustration, really great illustration. It just means that their vagus nerve, I'm telling you, if you follow the neurology of almost all diseases, including mitral valve prolapse, heart arrhythmia, chronic sinusitis, Meniere's disease, migraine headaches, gastroparesis, ulcers, liver disease, a kidney disease, chronic headaches, neck pain, fullness in the ear, swallowing difficulties, you'll see it leads right to the vagus nerve. Okay, next. This was a patient that I recently saw from Denmark. Mm-hmm. Yeah, Denmark. Look at her symptoms. Balancing difficulty, burning pain in the neck, brain fog, breathing difficulty, constipation, dizziness, drop attacks. I've had a drop attack, so just know, I know what a lot of these things feel like because I was involved in a very bad car accident when I was 14 with my father, and the first area I had treated with prolotherapy was my neck. So just know, when I talk about these things, I really know about these things. I know about nausea coming from the neck. I know about, vision problems and all these things. Drop attack is where all of a sudden you're on the floor, like you literally drop to the floor. She has heart pain, light sensitivity, muffled hearing, nausea, pale lack of color in the face, poor sleep. She can't make saliva. How many of you can't make saliva and nobody can tell you why? She has swallowing difficulties, tinnitus, ringing in the ears. She loves to sing. Her voice doesn't work. So does Maria have like 16 different diagnoses, or might she have just cervical instability causing compression, stretching, and injury of her vagus nerves? So let's see what Maria had to say. Now, granted, we interviewed her for 50 minutes. We're just going to show you 2.5 minutes of an interview that we did when I was seeing her after one visit of prolotherapy.
No one in Denmark or in other countries took me like holy, yes. Like totally holistic. So I gave up. A few years ago, I just gave up. My neck started to get swollen. It was very painful to touch, and finally I started to lose kind of sensation by touching. For example, I started to have a lot of somatic problems, like dryness of my, mucosa,
Dryness of the mucosa, like you couldn't
Yes.
produce saliva.
I couldn't produce saliva.
You couldn't produce
in mouth,
saliva.
in nose, and also, down in the anus. And so I was really, how to say, shocked, nicely shocked, really nicely shocked that after first treatment, now it will be 6 weeks ago, I go home to hotel nearby clinic. I wake up and I go to toilet and normal stool. And it repeated every day since. I try my voice because it was always like cracking, and it was sometimes difficult for me to, in the morning, to come out of the voice. If someone called me very early morning, I suddenly was surprised I could not get sound, yeah? But this morning, I just said to my daughter, and I said, Anya, what happened? And I started to sing the song, and I could sing the whole song with full breath. So then, again, I did.
Because you love to sing,
what?
right? You love to sing.
Yes, I love.
And the illness that you had, you kind of lost your voice. Really, you couldn't really sing.
Yes,
right after prolotherapy, you could then sing.
Yes, but also this amazing, and I want to thank you, Dr. Ras, very much. Because I could not see things, how they hang together. But with your interview, when you asked me a lot of questions, and you put immediately this together, nervus vagus.
Yeah, vagus nerve, yeah.
Vagus nerve, yeah. But of course, as a nurse, I have seen so many cases of patients with so similar suffering and similar and completely different diagnosed, and just with prolotherapy, you could just make it, So I'm just so happy.
If I could have the next slide. Wow, that now, just note, Maria's response is pretty remarkable, but I just wanted everybody to see that once the compression on the vagus nerve is stopped, so obviously Maria, just with the first prolotherapy session, we're soon going to talk about what prolotherapy is. Once the compression on the vagus nerve stopped, her vagus nerve function right away returns. So I definitely have people that come here for treatment where their stomachs have stopped working. So in other words, they've lost a tremendous amount of weight, and we do the first treatment, and right away their appetite comes back and their stomach starts working. So the results with prolotherapy can be quick. In some people, it does take some time. Most people don't realize vagopathy, so that's what I call vagus nerve injury, vagus nerve problems, vagus nerve degeneration, vagopathy. So if everybody could write down the term cervical vagopathy. So cervical vagopathy is where that a change in the structure of the neck from cervical instability injures the vagus nerve. And then we're going to show slides of this, but cervical vagopathy is when there's changes in the structure of the neck, like the structure of the neck loses the lordotic curve and it becomes reversed, and we'll show this. And that's from cervical instability, and ultimately the vagus nerves become injured. And when the vagus nerves become injured, you can get anxiety for no reason. Your vision becomes blurry. You get burning sensation and body pain. You can't urinate. You're depressed and you don't even know why. Like I said, that patient that had a doomy feeling. You get difficulty breathing. You eat the littlest bit and all of a sudden you feel full. Well, why is that? Well, you need the vagus nerve to function for your body to make stomach acid. So imagine if you don't make stomach acid and the food's just going to sit there because the acid's not there to break down the food. It's not even that. It's not only that. For the food that's broken down in your stomach to go into your duodenum, the pyloric valve has to open. Well, guess what opens that? That's the vagus nerve. You've got gastroesophageal reflux. Nobody can figure out why you have gastroesophageal reflux. Well, the esophageal sphincter right here, the lower esophageal sphincter, that what determines whether that opens and closes, it's the vagus nerve. You feel like you can't get any breath, and then your voice changes. Well, what is the nerve supply to the vocal cords that open and close them? The vagus nerve. Your hearing, it comes and goes. Sound, you have sound sensitivity. You don't like the volume of Dr. Hauser's voice. It's too loud. Well, what dampens? What's the nerve supply that helps dampen sound? Well, that's the vagus nerve. You've been diagnosed with Meniere's disease, and all of a sudden you feel like there's fluid. There's fluid in your ear. There's fluid in your ear. Then you get ringing in the ear. Well, what causes the eustachian tube to open? Well, one of the muscles is the levator veli palatini muscle. The levator veli palatini muscle, that causes the eustachian tube to open, then the fluid drains, then you can hear fine in your ear, and your balance isn't off because you have pressure in this ear, too much pressure, and normal pressure in this ear. When the levator veli palatini muscle doesn't elevate the palate, the uvula deviates. So see these uvulas here? See how some of them are deviated to one side? You, everybody here listening to this, you should look at the uvulas of yourself, of your friends. Put a flashlight in the back of your throat and say, ah, ah. Your uvula should go straight up and down. If it deviates to one side, let's say it deviates to the right. If it deviates to the right, it means that your left levator veli palatini muscle is not working, and the nerve supply to that muscle is the vagus nerve. So I could tell you definitively you got a left vagus nerve issue. If you also have any sort of neck pain, neck stiffness, tightness in your neck, cracking in your neck, then most likely the structural cause of your vagopathy is going to be cervical instability. There's holistic providers here in Florida that I taught this to. So every person that goes into their office, they ask them on the first visit to say, ah, and if the uvula deviates to one side, they have to come and see me and get an evaluation for cervical instability. And the way we do this is digital motion x-ray, which we'll talk about soon. So somebody who has hoarseness, that's a sign of vagopathy. If you look at an image and then all of a sudden you still see the image when you look away, that's a sign of vagus nerve issues. Any kind of dizziness, lightheadedness, that's from vagopathy. The vagus nerve is involved with fertility, orgasms, pelvic floor. You got pelvic floor issues. That can be also a vagus nerve issue along with a structural pelvic issue. If your temperature regulation of your body's screwed up, this part's cold, that part's hot, or all of a sudden you can't tolerate heat or you hate cold, temperature regulation involves the vagus nerve. If you're oversensitive to light, like you want to be in a dark room all the time, most likely you got a vagus nerve problem. You have restless legs. All these things involve the vagus nerve. Next. Okay, this is Dr. Hemwell. You see Dr. Hemwell and I in the early 90s. That's in the Oak Park office. So we have an office in Oak Park, which is a suburb of Chicago. So anybody around the Midwest know that we have an office in Chicagoland. Dr. Hemwell was the world expert in prolotherapy. He was taught prolotherapy from Dr. Hackett, so you see him and Dr. Hackett there in the Minneapolis paper. Dr. Hackett coined the term prolotherapy. Prolotherapy stands for proliferative therapy. Prolotherapy stimulates the body to repair painful areas. The weak link in the structural support of the human body are the ligaments. Ligaments connect one bone to another bone. So in other words, the skeletal system has to handle the weight of the body. The lower back handles, the weight of the body. The neck handles the weight of the head. And when people are face down looking at a cell phone, looking at a tablet, looking at a computer, the ligaments are under such amazing stress that they stretch out. When a ligament is stretched out, that's called ligament laxity. Ligament laxity. Much like the screws of a hinge, when the ligaments get loose, the vertebrae or the joints move too much. When the vertebrae move too much, that's called spinal instability. When it happens in the neck, that's called cervical instability. When your knee joint is clicking or your ankle joint is clicking, that's called knee instability or ankle instability. The cause of that is ligament laxity. The only treatment in the world that can tighten a chronically stretched out ligament, can tighten it, is prolotherapy. I'll be there in a second. And prolotherapy involves injections that tighten ligaments. So what prolotherapy specifically does is the solutions that are injected, they cause the immune system to come to the area and repair the area. Most tissues of the body, like if you sprain an ankle, it heals over 4 to 6 weeks. You break a bone, it heals over 4 to 6 weeks. So prolotherapy injections are given every 4 to 6 weeks. There's lots of different proliferants. The main proliferant that's used is D-glucose or dextrose. When a person injures themselves, cells burst open. Those cells release the sugar, the normal sugar in the body, D-glucose. So this D-glucose is released. That D-glucose then attracts cells to the area. So if a person has vagus nerve degeneration from destabilization of their neck and the vertebrae go into places that they shouldn't and it injures the vagus nerve, the treatment of choice is going to be correction of the cervical kyphosis or loss of lordosis, and then tightening of the cervical ligaments. Now I'm going to take a question.
Yes, we have 2 questions from a Facebook viewer. What are the side effects of prolotherapy, and how do you feel after getting a treatment?
Okay, most of the people after prolotherapy feel tightness in the area, so you'll feel tightness. Honestly, most people feel better right after the treatment. The reason is because all the swelling then stabilizes the neck, and if that's causing the vagus nerve issue, like I'll give you an example. I had a young person who had lost 20 pounds in the month prior to coming, so I didn't feel comfortable with them getting the treatment and then leaving. So I told the family they have to stay here till their stomach function returns. So I did the prolotherapy. I did the prolotherapy on a Thursday, then I saw them back in the office on Monday. And over the weekend they ate normally, the stomach function returns, and then they were okay to be discharged. The risks of prolotherapy is mainly where the needle is. So I would caution people to choose your prolotherapist wisely. And I'm just telling you that very few prolotherapists have the skill level to get cervical instability better, especially if your vagus nerve is involved. So I'd really encourage those who have really serious issues like vertigo, dizziness. In other words, their health conditions are such that they're basically disabled. I'd really encourage them to see me and my team here in Fort Myers, Florida. So back to the question. So on the consent form, it will say infection is a risk, but the risk is very, very little. It really relates to where the needle is. So, obviously if the needle goes into a nerve, you could injure the nerve. If the needle goes into the lungs, it could puncture the lungs. But I've been doing this for 27 years, and it's just a very, very safe procedure when it's done by somebody who's skilled at it. And I've probably done over 4 million injections. So if anybody wonders, and then probably treated anywhere from 60 to, I probably have 60 to 80,000 sessions of prolotherapy that I've done. Next. So we're going to show how we document cervical instability that causes vagus nerve problems. So if we, we're actually going to show, no, we're actually going to show prolotherapy. So you'll see prolotherapy here. So this is me doing prolotherapy treatment. This is actually, we videotaped this just last week. So you could see my attire is very professional. Arriba. That's Speedy Gonzalez. So that's prolotherapy without x-ray guidance. Then for C1, C2 instability, you could see me with the x-ray equipment, and then I'm looking over there to see the needle placement to make sure that the C1, C2 areas are treated appropriately. And you could see we have lots of ways to get people through the treatment. Some people are worried that they're going to jump or the treatment's painful. So we do numb the neck. We can, of course, give people medications like Xanax, Vicodin, and Caring Medical Florida is a level 2 surgery center. Some of the young people that have Ehlers-Danlos syndrome, or they have really significant instabilities in multiple areas, they choose to get conscious sedation. So we do, that's available. And then also we have laughing gas. So the brain and vagus nerve. So remember, there's a vagus nerve on the right side of the neck and one on the left side of the neck. They are the conductors, of the neurologic system under calm circumstances. So what this means is that how is the body knowing how much stress it's under, how much stress it's under? That's through the vagus nerve, and the vagus nerve tells the brain, hey, we're not in any danger, things are calm, we have plenty of nutrients, the hormones of the body are good, it's safe. So that's a body that's healthy, and there's no imminent danger. Next. The vagus nerve is the body's sixth sense. So what does the vagus nerve exactly tell the brain or other organs what? So the vagus nerve tells the brain, hey, I'm hungry. My blood sugar's low. So, hey, we need to eat. If you hear something, the vagus nerve is involved with, hey, there's danger here, or there's not danger. If your blood pressure is too high, the vagus nerve will be called into action to lower the blood pressure. The vagus nerve also monitors circulation in your heart, circulation to your brain. The vagus nerve monitors digestion. It monitors whether you should drink something or do you have enough salt in your body so your blood pressure is good, or do you have POTS? If you have postural orthostatic tachycardia syndrome, you have a vagus nerve problem. If you've been diagnosed with mast cell activation syndrome, you have a vagus nerve problem. If you have allergies, the doctor said, you're allergic to this, you're allergic to that. Well, you have a vagus nerve problem. If your immune system status is not good, you have a vagus nerve problem. If the doctors can't determine why you have such low hormone levels, you have a vagus nerve problem. The vagus nerve monitors your gut flora. If you have a gut flora problem, you probably have a vagus nerve problem. If there's different nerves of your body that aren't functioning good, you've been diagnosed with multiple sclerosis, you have some weird neurologic problem, you probably have a vagus nerve problem, and you most likely have cervical instability. If your organ function isn't good, imagine a person, all of a sudden they go to the doctor and the doctor says, you have the beginnings of kidney disease and you don't have diabetes. You're like, what? What caused that? And the doctor says, I don't know. I'm just telling you, you probably got a vagus nerve problem. So the vagus nerve is the body's sixth sense for all stressors, including visual stressors. So that means that if you or somebody you love, you think the pathophysiology of their chronic health problem involves the vagus nerve, you should encourage them, or you, if it involves you, you got to make sure that you are not looking at things that are stressful. Like, I don't know all the politics around the world. I don't watch TV, right? I don't watch TV. Why don't I watch TV or see stressful things on TV? Why? Because I want to help the person next to me. I want to help Izzy. You know, I want to help my wife. I want to help my friends. I want to help my patients. So, again, if you have a vagus nerve problem, you got to get your life where all the things you see, all the things you say, all the things you hear, they're happy things, they're calm things, they're joyful things, and it's given health to your body. Okay, next question.
Dr. Hauser, we have another question from Facebook. Could hay fever be related to the vagus nerve?
Yeah, hay fever. So I have a whole section in the new book on that. Yeah, any kind of allergies. Now, obviously, just so you know, I have a history of ragweed. I got allergy shots when I was in medical school. One of the times I had an anaphylactic reaction, so I almost died from the allergy shot. So I even know what anaphylaxis feels like. I was probably 5 minutes from dying, basically. Like I got my allergy shot, then 3 minutes later, by the time I got a rash, then like I could barely breathe. So if I would have left the allergist's office, I would have died. So the question always is, this is interesting, what I'm going to say is, why is one person allergic to ragweed and somebody else isn't? Like, think of that. Everybody's getting exposed to the same ragweed that causes hay fever. It's a good question, right? Like, you know, so the reason that one person has a ragweed allergy and somebody doesn't, who lives in the same house, say, they're getting exactly the same exposure to ragweed, it's because one person's vagus nerve is strong and can function fine, and the other person's vagus nerve is weak or degenerated. And you could say, well, no, it's my 7-year-old son. Yeah, let's scan your 7-year-old son with a digital motion X-ray, which we'll see, and you'll see that the neck's a disaster. So their vagus nerve is a disaster, and that's why the allergy shots, they don't cure the problem. They don't totally get rid of the problem. The symptoms might go down. To get rid of the problem, you don't need to move. You just need to get the vagus nerve functioning normally, and then the person can inhale as much ragweed as they want. Next. Okay, so remember I said the vagus nerve wanders. It's the longest nerve of the body. Stimulating the vagus nerve, it shuts off inflammation in the body, including sinusitis or allergy symptoms like ragweed. That's what shuts it off, is the vagus nerve. The vagus nerve slows breathing, heart rate, blood pressure. It gives the body calmness. So right away, if you check your pulse, like if we check my pulse right now, you know, it's probably under 60. You know, it's under 60. If your baseline pulse is like 80, 85, I'm just telling you, your vagus nerve, it's not doing good. If you normally are a hyper person, your vagus nerve isn't doing good. If you normally have racing thoughts, think, racing thoughts, I'm under stress, your vagus nerve isn't doing good. If you have a chronic health problem, nobody can figure out what's wrong, you have a vagus nerve problem. Next. Okay, this is what the vagus nerve looks like. Yeah, and you know, that's a cross section of the vagus nerve. And what we're going to see is the vagus nerve is actually 100,000 neurons. Like, we forget. It's not, yeah, it's one nerve, but within the nerve is 100,000 nerve cells. 100,000. Okay, next. This is just one of the studies, and you see that the average amount of neurons in the left vagus nerve is 87,000, and in the right is 105,000. So most people's vagus nerves are bigger on the right than the left. Okay, Now, we all know about the enteric nervous system. So the enteric nervous system is the nervous system that's within the digestive tract. In the digestive tract, there's something like 100 million, to 500 million, depending on who you read, enteric neurons. If there's only 100,000 vagus neurons, and let's say half of those go to the digestive tract, that means that every vagus neuron innervates 1 to 3,000 enteric neurons. So why am I saying that? It means that if you knock out one vagus neuron, it's going to affect up to 3,000 neurons in your digestive tract. So think of that. Next. This is what a neuron looks like. That's one neuron. So see that big eye thing in the middle, the big eye thing in the middle? That's the cell body. So this is really important. So the cell body, that eye-looking thing in the middle, that's the brains of the neuron. The brains of the neuron. That's the genetic code. That's where the genetic code is of the neuron. That's what tells the neuron what to do. So I just want everybody, so the cell body is what tells the neuron what to do. Next. This is what it would look like, the vagus nerve interacting with 1,000. You'll have one neuron that's interacting with like 1,000 other neurons. So that's what the vagus nerve, it goes all over the body. But just know there's not that many vagus neurons compared to other nerves in the body. There's very few. Next. And then when the neuron starts to degenerate, basically the flow of substances within the neuron starts slowing, and then the neuron starts to explode on the inside. Next. Okay, here are the vagus nerves. So now we're going to go into the nitty-gritty of what can injure the vagus nerves. So the vagus nerve goes into the brain through a hole called the jugular foramen, and the vagus nerve goes from around right here in the brainstem, goes through the jugular foramen, runs on the anterior portion of the neck, right in front of the cervical vertebrae, then it goes into the abdomen. But please note, see how the vagus nerve runs right in front of C1 on both sides. Next. Wow, look at this. The vagus nerve starts from the medulla oblongata. The medulla is the first part of the brainstem, and it connects to the spinal cord right at the top, right before your skull. So right before the skull, the spinal cord goes into the medulla. That's where cranial nerve 10, which is the vagus nerve, that's where it originates. The vagus nerve then goes through the jugular foramen in the front of the neck to the abdomen. When you hear the word ganglion, what a ganglion means is that the cell bodies of that nerve are located right there. So it means that the brains of the vagus nerve, the genetic code of all those neurons of the vagus nerve, the 100,000 neurons, they reside in the jugular ganglion and the nodose ganglion. The nodose ganglion sits right at C1. So see that? See the nodose ganglion? It sits right at C1. So the next thing to write down is the brains of the vagus nerve. The nodose ganglion sits right in front of C1, meaning that the easiest way for the vagus nerve to get injured is by looseness at the C1-C2 junction. You can turn your head, right? You can turn your head because of looseness at the C1-C2 junction. So it means that the most mobile segment of the spinal column is at C1, C2. So C1, C2 is already loose. So it's the easiest part of the spinal column to get injured. If you've had a head trauma, if you've had a whiplash injury, and then you got a bunch of symptoms, almost assuredly you have injury at C1, C2. If you feel like your head is too heavy for your neck, you most likely have C1, C2 instability. The head weighs 10 to 12 pounds. The head weighs 10 to 12 pounds. Do you know the C1 vertebrae only weighs 2 ounces? So think of that. The head is sitting on something that weighs only 2 ounces. And guess what keeps the C1 and C2 together? There's no disc. There's no disc between C1, C2. So how does C1, C2 stay together? It stays together by ligaments. So ligaments are very small structures. Many of the ligaments are only, a centimeter. So 10 millimeters. Many of them, their thickness is only like 2 or 3 millimeters. So if the C1, C2, so I'm going to get this model again. So this is the head, this is the spinal cord, this is C1, this is C2. So if C1, C2 gets loose, and it starts banging on the front here, it starts banging in the front there on the vagus nerve, it means you could literally be, every time you turn your head, you could be smashing into your vagus nerve. Then over time, the vagus neurons start dying. So somebody could go from 100,000 neurons to 90,000 neurons to 80,000 neurons. So we call that vagus nerve degeneration. And the area of the vagus nerve that gets injured with that is not just any part of the vagus nerve, it's actually where the genetic code is of the vagus nerve. So imagine destroying the brains of the vagus nerve. So then all of a sudden the vagus nerve cannot sense correctly what's going on into your stomach. So you eat and the vagus nerve isn't saying, hey, we got food in the stomach. I sense food in the stomach, so we need stomach acid. So then all of a sudden there's no stomach acid. Then it also is saying, hey, it's not saying, hey, we got to release the stomach contents into the intestines so it doesn't open the pyloric valve. Or you have an area in your intestines that's all inflamed and the vagus nerve doesn't sense the inflammation, so it doesn't get rid of it, and then you get Crohn's disease or ulcerative colitis. Or it's not giving the right sensation, the right input in regard to the kidney, and all of a sudden you start getting kidney disease. And nobody knows the cause. Well, lo and behold, the cause can be vagus nerve degeneration from neck instability. Next. So look at this. Look at where the jugular ganglion is of the vagus nerve, the nodose ganglion. And now I'm going to introduce another ganglion, which is called the superior cervical sympathetic ganglion. So see how that sits right at C2. The superior cervical sympathetic ganglion does what? It gives tone to the blood vessels that go to your brain, go to the eye, go to your inner ear. So we have good circulation in part, or normal circulation, through the carotid arteries, through the vertebral arteries, through the ophthalmic arteries, to the eye, to the inner ear, to the face, because the superior cervical sympathetic ganglion gives it tone. The main inhibitory ganglion to the sympathetic system of the body is the vagus nerve. So the vagus nerve, one of its main function is to inhibit the sympathetic nervous system. 90% of the sensory input of the parasympathetic, or the calming part of the nervous system, is through the vagus nerve. So if you feel like your adrenaline system or your sympathetic system is too active, right? Your pulse rate is high, your blood pressure is high, you can't calm down, you have cold extremities. You have cold extremities. You have a sense like something's off in your brain, almost like the brain's not getting enough circulation. Probably your sympathetic tone is too high and your parasympathetic is too low. So you don't have enough vagus tone. There's something wrong with your vagus nerve, and most likely it's from a problem in your neck. And the way you're going to monitor that or measure that is actually called heart rate variability. And we're going to talk about that later in this talk. Next. So this is another view. It shows you that C1, C2 instability or malrotation or subluxation can affect not just the vagus nerve, but the sympathetic system. Next. So when your vagus nerve is not functioning correctly, the only thing monitoring your system that's working is your sympathetic system. So you're going to be in a storm, like you're stressed all the time. And of course, anybody under stress all the time is going to end up with a disease. If you want to get health, the body has to have high vagal tone and calmness. Okay. So what happens is, this is just, and so some of these slides, I give you the scientific reference. So any stressor can injure the vagus nerve. So it isn't just a structural stressor. You can have, like, say somebody was raped, or they're in a terrible marriage, or they hate their job. Just know that can injure the vagus nerve. Next. So the vagus nerve shuts off all harmful body stress. So write that down. The vagus nerve shuts off harmful body stress. So when the body's under a very big stressor and your vagus nerve doesn't function normally, you're going to get a disease. But somebody else who has high vagal tone could be in a worse marriage than you, could be under more stress than you, and they're totally, completely healthy. So the vagus nerve is what helps a person handle any kind of a stressor. So that's really important to know. Next. Okay, this study just shows that as the nodose ganglion neurons get more and more as more and more of them die. So as the nodose ganglion neurons die, what happens is the animals die. So this was an animal study where the animals they got under a major stressor, and they tested how many of the vagus nerve neurons died. And the more they died, the more animals died. And the animals died by coronary artery vasospasm. So if you have degeneration of your vagus nerve, you can get vasospasm. So anybody who's had a heart attack, or they have a heart problem and the doctors can't find any plaque, but they have angina, you got a vagus nerve problem. Next. Okay, so this is a lot of rabbit studies. I just summarized the studies, but in summary, when you get vagus nerve degeneration, and the degeneration occurs primarily at the nodose ganglion, which is at the level of C1, you get vasospasm. You can get vasospasm in your brain, in your heart, in your lungs, in your kidneys. Vasospasm means that the circulation goes down. You have decreased blood flow to the brain, decreased blood flow to the heart, decreased blood flow to the lungs, decreased blood flow to the kidneys. So somebody who has a respiratory problem and they don't know the cause, like all you know is you're short of breath. Well, you might want to get an assessment to see if you have a vagus nerve problem, and get a digital motion x-ray to see that if you have cervical instability. Somebody has heart problems, intestinal problems, lung problems, dizziness, kidney problems, and nobody knows the cause, and you've gone to a holistic provider and things aren't improving, you really should get an assessment for how your vagus nerve is doing, whether or not you have significant upper cervical instability. Next. Okay, here's some key points on the vagus nerve. There's 40,000 to 100,000 neurons compared to the eye, which has 1 million. The enteric nervous system has 100 million, and the brain has 1 billion. That's why you can go on a drinking spree and kill a bunch of brain cells, but your brain still can work pretty good. You can't afford to get your vagal neurons dying because you don't have a lot of them. The vagus nerve innervates basically all the digestive tract. Each vagus neuron innervates 1,000 to 3,000 enteric neurons. The vagus nerve cell bodies are altered by instability at C1. There's 330 different genes that are at the jugular and nodose ganglion. This is interesting. Those neurons some of those neurons are dedicated to itch transducing neurons, meaning that if you have hay fever or you have eczema or you just have like itching, like all you know is a certain part of your body itches and you don't know why, it's probably because you have a vagus nerve problem. And basically the vagus nerve innervates all the organs that are portals of entry for pathology, which means the mouth, the lungs, the nose, the digestive tract. Next. So the vagus nerve, as we said, can be injured by systemic causes and structural causes. The main structural cause is cervical dysstructure from cervical instability. The main systemic cause is basically stress. It's overwhelming stress. The stress, some of the stress is because you're eating too much, people are overweight. When you mouth breathe, that's not as good as you nose breathe, and we'll talk about why that produces a stress. So anybody who's a mouth breather should become a nose breather. Any kind of toxicity can injure the vagus nerve. Next. Okay, and this kind of shows the vagus nerve interacts with a lot of different nerves. So the vagus nerve interacts with the facial nerve, trigeminal nerve. Somebody who's been diagnosed with trigeminal neuralgia and they don't know the cause. The cause is probably C1, C2 instability. Anybody with facial pain, headaches, any kind of migraine headache, tension headache, facial pain, probably has C1, C2 instability, and it's affecting the vagus nerve. And just know if you have vagus nerve issues, all these common severe stressors, if you want to get your vagus nerves back to normal, all these things pretty much got to get resolved. So people, even my own patients, if they have unresolved family conflicts, emotional problems, I can treat them with prolotherapy and help reduce the structural cause of their vagopathy, but they do better. They heal quicker if the other stressors are also being dealt with and resolved. So diet does play a role. Working long plays a role. Any kind of stressor can injure the vagus nerve. Okay, next. And these are just the various ways where nerves can get injured, including the vagus nerve. So when you have changes in your cervical curve from normal, those changes can cause all these stressors on nerve tissue, including the spinal cord and the vagus nerve. So meaning that if the vagus nerve is under abnormal tension, the neurodynamics, the way the vagus nerves move, if it torques in a bad way or it gets compressed, basically ultimately neurons are going to get damaged, neuron cells die, and then long-term nerve impulses from the vagus nerve do not get through. Then if the vagus nerve impulses don't go to the vocal cords, for instance, a person can feel like they can't get air, or their voice quality changes, or they can't sing anymore. So that's basically what's happening, is the nerve impulses aren't getting through. And then obviously if the vagus nerve is involved with monitoring the digestive tract, then and the nerve impulses aren't getting through, then the brain isn't going to get the right information about what to do for the vagus, for the digestive tract. And then of course symptoms come on, bloating, pain, gas, irritable bowel, bloody stools, and the treatment of that would be resolution of the vagopathy. And in my experience, the number one cause of it is ligament laxity because of whiplash injuries, head traumas, sports injuries, falls, and then of course the cell phone, the tablet. So if anyone's struggling with health, I'm just telling you, you got to start looking up. So you got to get your computer system up. You got to be looking up. You got to get the muscles in the back here. You got to get your cervical curve restored. And if you have instability in the neck, it's got to get resolved. Otherwise, the condition is going to progress, because instability is a progressive disorder. If you have a loose hinge on a door and you keep opening and closing the door, the next hinge is going to get loose. So instability is a progressive disorder. So the way you resolve instability is document that you have it by digital motion x-ray, and then you treat it with prolotherapy, because that's the only treatment that tightens chronically stretched out ligaments. Okay, so think about if you take your thumb and you blanch your skin, that's all the amount of pressure that's needed to injure your vagus nerve. The vagus nerve runs within 3 millimeters of the anterior vertebral bodies in the neck, within 3 millimeters. So if I do a digital motion x-ray on somebody, and when they bend forward and we show that the vertebrae moves too much by 4 millimeters, it means that every time they use their cell phone, they could be damaging vagus neurons. So yeah, next. And this is a pictorial of it. So if you got ligament damage, and the most common ligament damage that we find on digital motion x-ray is the capsular ligaments, and then that can impinge on the vagus nerve when the vertebrae moves too much. Next. So this is what it looks like. See, on the left is a lateral x-ray of a normal neck where they have a good normal curve. And see how the vagus nerve is relaxed, and see the abnormal curve. So that's what we find. And I'm just telling you, even in the young people, when we do an x-ray, a digital motion x-ray on 7-year-olds, 11-year-olds, 12-year-olds, because of all the looking down at tablets, playing games on the computer, cell phones, people's curves are terrible. And that curve that you see there is very common. So the curve on the right, the abnormal curve, you could see where the vagus nerve has to turn. Well, that's right where C1 is, the nodose ganglion. So that's where the vagus nerve is getting injured. And that's the brains, where the brains are located in the vagus nerves. So that's what's causing the cervical vagopathy. It's basically cervical destructure. So cervical destructure is a term that I made up that means that the supporting structures of the neck are injured. So the cervical curve, the cervical spine no longer has stability. So once the cervical spine doesn't have stability, the curve changes. But unfortunately, the curve changes because the weight of the head is forward. The curve, instead of being the weight of the head being behind the cervical curve, when the cervical curve changes, the weight of the head is in front, which promotes further and further destructive changes of the cervical curve. when those destructive changes occur, the vagus nerve, the spinal cord, the other cranial nerves can be stretched up to 3 inches. So think about that. Imagine taking a nerve, which is like a rope, and you stretch it 1 inch, 2 inches, 3 inches, it's going to get injured. And that tension on the spinal cord, because of that stretch, can cause the brainstem to be injured. And that's where you get like nausea. People have unexplained nausea, or they're off balance, or they feel like they're on a ship, like they're still on a ship and they're kind of seasick all the time. That's from this process. Anybody with unexplained dizziness, vertigo, tinnitus, headaches, this process is what's going on and it is the cause. Next. So when you have ligament laxity in the neck, it causes cervical destructure, which is a destruction of the supporting structures of the neck. Ultimately, the vertebrae go into abnormal positions, and those abnormal positions ultimately cause injury of the vagus nerve. When the vagus nerve is injured by destabilization of the neck, I call that cervical vagopathy, and the combination of that is called Hauser's disease. Next. So the vagus nerve runs alongside in the carotid sheath with the glossopharyngeal nerve and the accessory nerve. The accessory nerve, that's what innervates the trapezius and the sternocleidomastoid muscle. So if you think you have a vagus nerve injury or vagus nerve problem and your trapezius muscles are tight, that's a sign that you have a neck problem. The glossopharyngeal nerve and the vagus nerve, they innervate the muscles of the larynx and the esophagus. So anyone with a swallowing difficulty, they feel like something's getting stuck. Their vocal cords aren't working right. They can't catch their breath. Most likely you have a glossopharyngeal and or vagus nerve problem. And you could see all those things run right by C1, C2. So you should get an evaluation for C1, C2 instability. Okay, now we're going to show you one of the scans that shows how we document C1, C2 instability. So the process is called digital motion X-ray. So this is what an unstable C1, C2 looks like, and this is through the mouth. So we're doing a motion scan, while the person moves, and you could see that the vertebrae move too much, and that's called overhang. And then what we do is we do prolotherapy, and this is what it looks like when we're done, when the treatment has been successful and the ligaments have tightened, then the person regains their stability. And then we call that a stable C1, C2. Then the C1, C2 is not banging on, stretching the vagus nerve. Now, along with that, in many cases, we have to do curve correction. Curve correction is a separate issue from prolotherapy, so we give people exercises as well as weights and different things to get their curve corrected. So anybody wanting more information on that, I recommend that you go to our website, caringmedical.com, and then I'll talk about that more in subsequent webinars. Next. This one's really important. So if I was going to say one of the key figures in this talk, it's this one. So if you look here, see how there is blood vessels, see how there's blood vessels within the vertebrae. They're actually within the vertebrae. So as severe as vagus nerve issues are, it's very severe. But just know there's even cervical instability issues that are more severe. So when a person has cervical instability, it can cut off blood supply. It can cut off blood supply to the brain. So that's even more significant than vagus nerve issues. many people who come to see me specifically, they have vagus nerve impairment, but they also have compression of various blood vessels. So the way that we document that a blood vessel is getting cut off to the brain. So imagine a person has a part of their brain that's not getting blood supply when they move a certain way. Well, think of all the things that could cause. Do you think that would cause anxiety? Do you think that would cause brain fog? Would that cause fatigue? Could that cause seizures? Could that cause Parkinson's? And you could go on and on as far as panic disorder, general anxiety disorder. Of course it could. So the way that we document blood flow ischemia is by transcranial Doppler. So we're just going to show you really quickly some pictures. This is actually what it looks like. This is Jamie. Jamie, she's on our website. She has dystonic storms. So it's a kind of seizure. It's really a kind of seizure disorder. Not exactly, but what happens is Jamie, had these life-threatening dystonic motions where she couldn't breathe and this and that. So we documented that when Jamie moved a certain way, her blood flow to a certain part of her brain stopped, and guess what happened? When we stopped it for about 7 seconds, then bammo, she started to get a dystonic storm. So that's how we document it on the website or in the office. So please feel free to go to caringmedical.com to actually see some scans. So the next one. This is interesting. This is actually what a headache looks like with transcranial Doppler. So we can, with ultrasound, high resolution ultrasound, there's parts of the bone that the beam goes through, and we can actually see the blood vessels. And when the person has a headache, they have vasodilation, and this person was getting a headache, and you could see that one side of the brain was the blood vessels were dilated. So yeah, that's what a headache looks like with transcranial Doppler. Next. So this is actually what happens in most people. They look at their cell phones too much. I just call it the face down lifestyle. That causes cervical ligament injury. The cervical curve changes. There's anterior displacement of C1. Ultimately, then that causes stretching, compression of the cranial nerves. It can cause the blood flow to stop with certain motions. So the person ends up with blood flow ischemia, autonomic nervous system impairment, cervical vagopathy, and ultimately chronic health problems. Next. I think this really illustrates this. You can see that the C1 and C2 are 2 to 3 inches from where they should be, and that causes a stretching injury of the vagus nerve. Just know it also can cause injury to the spinal cord, other cranial nerves, and even the brainstem. That's what I was saying. So on digital motion X-ray, we can show that there's forward displacement of the various vertebrae, so we can document where the ligament damage is and then direct prolotherapy to those areas. Cervical destructure or changes in the cervical curve can cause a neuralgia. So you can get vagus neuralgia or vagus neuritis, meaning that the vagus nerve is inflamed, and that can cause unremittent pain in like the throat. So somebody who has like throat pain, that's terrible. Then vagus neuralgia neuritis can cause ear canal pain because the vagus nerve is the sensory nerve for the inner canal. But if the condition occurs too long, you end up getting vagus nerve neurons dying, and that's when you use the term neuropathy. So you don't want to have vagopathy or vagus nerve neuropathy, because it means that the most important nerves of your body, the cells are dying. And when enough cells die, basically you die. So it's a very, very serious problem. So anybody who has a vagus nerve issue, I'm telling you, it's a really, really serious problem that you got to get help, because it's a progressive disorder. And once the ligament support of the neck starts going, a person can go from a little bit of symptoms to a lot of symptoms, life-threatening symptoms, very, very quickly, where once the stomach shuts down, once appetite shuts down, you can lose weight really quickly. Right away, you can get all of a sudden anxiety, panic, and beside just the normal symptoms that cervical instability cause, which is tightening real high up here, clicking in the neck, tension in the neck, terrible headaches, dizziness, vertigo, ringing in the ears, blood pressure swings. Next. This is kind of what it looks like. So in other words, as everybody spends hours and hours looking down at a cell phone, this is basically what's happening to most people who are listening to me right now. So you could see that as your cervical curve changes, then that tension is going to ultimately get transmitted to your brain, the base of your brain, which is the brainstem. All the major centers of your body that are located there. So in other words, at the base of the brain is the main relay center for breathing, for appetite, for the nausea centers there, the heart rate centers there, the blood pressure centers there, the center that controls circulation in the body. So I don't know if if you're, I wouldn't want that part of the brain, let me just say it, to be getting injured. So it's very, very serious. So we all got to be on the alert if you have a vagus nerve degeneration issue, that it gets treated, and it gets treated appropriately. Next. So habitual forward head posture ultimately is going to lead to upper cervical instability, and that can lead to cervical disc degeneration, trigeminal neuralgia, occipital neuralgia, and of course all the things that we're talking about. Next. And again, if you have a child who's having a trouble, and nobody can figure out why, like they have developmental delay, they have autism, they're not walking good, you can't touch them, their neurologic development stopped. They were potty trained. Now they're not potty trained. They scream all the time. They have headaches. They don't eat certain foods. Their stomach always hurts. Even kids, you got to think like, wow, they probably got instability of the neck and it needs to get checked out. Okay. This slide is basically the summary slide of how cervical vagopathy causes all these things. So when you have cervical vagopathy, you have decreased stimulation to the endocrine glands, because the vagus nerve is what tells the glands to secrete things. Remember I said that if you don't have vagus nerve stimulation to your stomach, you don't secrete stomach acids, so then your food isn't digested well. So if your endocrine glands don't get vagus nerve stimulation, you may not secrete the normal amount of hormones. When your vagus nerve is injured, you get decreased anti-inflammation in the body. Your immune system doesn't work right. So that can lead to what? Body pain, neuropathy. You've been diagnosed with chronic Lyme disease or chronic yeast infections or candida, and you get on the programs the holistic doctors recommend, but you don't feel better. You probably got cervical vagopathy. When you don't have the normal stimulus to the internal glands, you can get gallstones. You can get poor food digestion. You look at your stool, right? Everybody should be looking at their stool to see if they have undigested food particles, right? You got undigested food particles, or your stools float. Stools aren't supposed to float. They're supposed to be the consistency of a banana, and then it slowly floats down. If your stool's floating, it means you have fat malabsorption. So you might have a vagus nerve issue. You have eye issues, you have macular degeneration, you have retinopathy, and you're a healthy person, you don't have diabetes, right? And you have vision changes, and the doctors can't tell you why you have all these problems with your eyes. You have glaucoma. Well, you probably have a vagus nerve issue, and you might be getting ischemia in your eye, your inner ear, because of vasospasms. You have brainstem degeneration. You've been diagnosed with, brainstem issues. Your balance is off. You have Parkinson's. You have psychiatric disorders, dementia. All these things could be from neck problems. The neck problems can cause cervical vagopathy, but realize when you have instability of the neck, it can cause spinal cord problems, brainstem problems. You can have blockage of cerebral spinal fluid flow. If you have head pressure, you feel like you always have head pressure, it could be the cervical instability blocking cerebral spinal fluid flow. So then the pressure builds up because the fluid around the brain has no place to go because of the blockage from the cervical instability, and then you feel pressure, and then that can cause injury to the brain, injury to the spinal cord. Next. This is really interesting. So a healthcare provider saw me who has Ehlers-Danlos syndrome, and then she is a physical therapist who's very, very good. And then all we did was a digital motion X-ray on her, and she sent me this. She sent me this email. So she said, immediately I felt increased brain fog, swallowing and speech issues, cervical pain, weakness, pain down the lower extremities, weakness in the lower legs, muscle spasms, swallowing and speech difficulty, brain fog, shooting pains at, and it goes on and on. So the point is, if you have loose ligaments, like you were born with loosey-goosey ligaments, and and the C1, C2 area is the loosest part of the neck. So this particular person, with the digital motion X-ray, I put her through motion she normally doesn't do. So because she's a physical therapist, she's just very careful with the way she moves. But it just shows that anyone who has a significant loose jointedness, like Ehlers-Danlos syndrome, or anyone who's been using the cell phone for hours and hours and hours, most likely you have significant cervical instability. So this person, all it took was moving in a few little motions during the digital motion X-ray, and they got all the vagus nerve issue things, right? The vagus nerve issue things. So this person is planning on coming for treatment next. We get all kinds of emails. This isn't a person that I've seen, but it just shows you. And this person works in academia. He says, I believe there may be a cure for atrial fibrillation with prolotherapy. And he just goes on to say he had a football injury, auto collision, and then after that, then he started getting atrial fibrillation. Then he would get chiropractic care and it would go away. So most arrhythmias are the heart rate is too fast, and the nerve input that lowers the heart rate, that's the vagus nerve. So somebody who doesn't have good vagus nerve input to the heart is at risk of getting an arrhythmia, and they're at risk of getting like mitral valve prolapse. They're at risk of getting valvular disease. They're at risk of getting vasospasms of the coronary arteries. So remember, there was the slide that if you have a chronic disease and nobody knows the cause, most likely you have a vagus nerve issue. So if I had atrial fibrillation, I would go to a cardiologist, but I would look into whether I have cervical disc structure from ligament injury causing cervical vagopathy, and I would then proceed to get prolotherapy. Next. So a broken neck is just you either broke the bones and the ligaments to give you instability, or you just broke the ligaments. So when we talk about ligament laxity, it's not a little issue. It means that you have instability. You have a non-stable neck. So imagine your whole head, your brain stem, sitting on something that's unstable. So it's a very, very serious condition. And it's a progressive condition unless something's done. And the thing that normally needs to be done is prolotherapy to tighten the ligaments, then some type of curve correction to get the cervical curve normal. Next. And what are the clues that a person has a vagus nerve problem? The first thing is, as soon as this talk is over, I want everybody to go into the bathroom with a flashlight and see if your uvula is deviated. Everybody you love, you need to start looking at their uvulas. The next time you go to a party, bring a flashlight and say, Joe, here, I got to look at your uvula. And if they have a deviated uvula, you better get it checked out. If you have sensitivity in your inner ear, if you have a non-working stomach, changes in your voice quality, swallowing difficulties, if you have a chronic health problem and you lay down in bed and it gets a lot better, you probably have cervical instability. When the doctors tell you that they don't know what else to do, you probably have cervical instability and better get it checked out. And we're going to talk soon about low heart rate variability. Occam's razor is the simplest solution, is usually the right one. So this was a patient who told me they have taste changes, like, in other words, in their mouth, things taste better, taste odd. There's a change in the taste. They have a metallic taste. Nothing tastes good. Difficulty swallowing. They have a chronic sore throat. They have left tongue numbness, left-sided facial numbness. Much of the left side of the body is numb. There's more hair growth on the left side of the body, and there's more perspiration on that side of the body. Their left arm can turn gray. They got red splotches. Sorry about this. And skin discoloration. They have anxiety, panic attacks, extreme fatigue, looseness in many of their joints, hand tremors, light and sound sensitivity, gastroesophageal reflux. People who've been diagnosed with SIBO, small intestinal bacterial overgrowth, right? That's common diagnosis. You have a vagus nerve issue. Dilated pupils. So when you do that thing in the bathroom, shut the lights off, see if your uvula deviates, then shine the light on a flashlight onto your pupils. The pupils are supposed to constrict. They're supposed to constrict with light. If one of your pupils doesn't constrict as much, you probably have a vagus nerve issue. Temperature sensitivity, dizziness, vertigo, crepitation in all the joints. Yeah. Does this person have 10 different problems or 20 different problems, 20 different diagnoses, or do they have just one? Cervical instability causing cervical destructure, which ultimately leads to cervical vagopathy. This is how we determine temperature. So when you have a vagus nerve problem, often the temperature in the ear canal on one side is less than the other. Next. We measured the vagus nerve diameter. So this is a study where they looked at people with Parkinson's disease. People with Parkinson's disease, they found that the vagus nerves are smaller than people who don't have Parkinson's disease. So in other words, we do ultrasound. So ultrasound is just a sound beam. We look at it in the front here. and you could see the jugular vein, the carotid artery, and in the sheath that those blood vessels are in is the vagus nerve, and that little arrow is where the vagus nerve. So we can measure the vagus nerve diameter, vagus nerve circumference, and we see that our patients that come in, often the vagus nerve is more degenerated on one side than the other, and that's the side where most of the instability is. Next. And then this is me actually doing hydrodissection on the vagus nerve. So we can do prolotherapy in the neck to resolve the instability. Sometimes we have to free nerves, or we have to inject substances like PRP or stem cells around nerves like the vagus nerve to cause them to regenerate. Most of the time, when you decrease the reason or you resolve the reason why the nerve was injured in the first place. So if you can resolve why the vagus nerve became degenerated by reducing systemic stressors, which means eat healthy, be in a safe, secure environment, be surrounded by people that love you, slow your breathing down, only listen to music that's uplifting. Don't listen to complaining music or music that stresses you out. Have pets, be outside, cook organic food, have a lot of laughter, right? All those things help the vagus nerve, increase vagal tone. Then if you have a structural problem causing the vagus nerve problem, such as reversal of the normal cervical curve, destabilization of the neck, then you have to get treatment, and the treatment that resolves instability of the neck is prolotherapy. We have many of our patients do heart rate variability testing. So heart rate variability is an index of the parasympathetic nervous system and thus the vagus nerve. People who have a high heart rate variability, they have a high vagal tone. High vagal tone correlates with health. So with this particular program, a good heart rate variability is 70. So this is Marianne. This is just, us monitoring her. You could see the probe is on her finger. So it's measuring the beat-to-beat variability of her heart rate. And the higher that number, the healthier it is her vagal tone. Next. Okay. And this just shows that the vagal tone index and resting heart rate. So the one indication using heart rate that your vagal tone is high is, do you have a normally low resting heart rate? But a better variable is heart rate variability. Next. So when you download apps on the internet for heart rate variability, what the monitor is going to do is measure the beat-to-beat variability of the EKG. So when you take a deep breath in, so I'm going to take a deep breath in, and we all should do that right now, your heart rate speeds up a little bit so you get more blood that's oxygenated. And then when you take a deep breath out, your heart rate slows down. So there's beat-to-beat variability. So people who deep breathe, who have slow breathing, their heart rate variability is higher. People who are all stressed out, boom, 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 their heart rate, boom, 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 they don't have variability in the beat-to-beat heart rate. So those people have low heart rate variability. And I'm telling you, if you go on the internet and you look at cancer survival, heart rate survival, likelihood you're going to get a chronic disease, the lower your heart rate variability, the more likely it is you're going to get a disease. So when you think you have cervical vagopathy, this is a really good thing you could do at home. We do a very sophisticated test in the office, to look at a lot more things than just heart rate variability and the various indicators that show how your vagus nerve's doing. but that's something you could do at home. And the interesting thing about that is, let's say you think the music you listen to, it's good for you. Well, why don't you monitor your heart rate variability while you listen to that music? And you might be shocked at, like, it's not good. Like, you know how most of us know intuitively that we should be listening to symphony music, Beethoven, Bach, Pachelbel. You put Pachelbel, like that's my go-to. You put Pachelbel on and your heart rate variability goes up. You start petting your cat or your dog, your heart rate variability goes up. You talk to somebody that stresses you out, your heart rate variability goes down. So all you have to do is get a heart rate variability monitor, have a lunch with that person, and you could say to them, Joni, I can't see you anymore, man. You know, my heart rate's variability is going down. This conversation is toxic. And boom, see, there you go. You got an objective reason. No, but most of us, we have to protect our health. And anything that the body senses as stress, and that could be what you're watching, right? You watch the things that are going on around the world. This person's getting bombed. This person's getting impeached. This person. You keep subjecting yourself to that, and your vagus nerve, it's going to go down. So I don't know about you, but I want to live to be 90. And you're not going to live to be 90, I can tell you for sure, if your vagus nerve is getting degenerated. So all of us have to start taking responsibility, being calm, making sure that what we say is a blessing to others, right? Every time you complain, you'll see that your vagus nerve function goes down. When you say something uplifting to another person, your vagal tone goes up. Every time you're in a situation that it's loving and it's secure and it's joyful and there's laughter, your vagal tone goes up. Every time you're in a situation where you feel unsafe, you feel stress, it's toxic, your vagus nerve goes down. You never forgave somebody. You're somebody who abused you. You were in a car accident and you hate the person who hit you because they were drunk driving. So unforgiveness is like taking in rat poisoning, thinking it's going to kill the rat. It just doesn't happen. So there has to be forgiveness. Get rid of bitterness. Eat healthy. Cook your own food. Don't ingest chemicals. Drink water that doesn't have chlorine in it. So make sure it's purified water. Be outside. Work in the garden. Have a job that you love. I love injecting people, so I'm in the right field. And I give a lot of prolotherapy, and the Bible says God loves a cheerful giver, and man, am I cheerful when I'm doing prolotherapy. Okay, next. There's so many studies. Like I said, I wrote a chapter in the new book on the vagus nerve, and there's 1,400 references in the one chapter. This is just one of the studies that showed that the higher the heart rate variability in the person, the greater the survival from a myocardial infarction. Next. It turns out most of us breathe 10 to 15 times a minute. So on many of the apps for heart rate variability, they'll have a way where it'll show you how to slow your breathing down, like you'll follow a monitor. And then it turns out that when a person breathes 6 times a minute, their heart rate variability is the highest. So all of us should be working on taking deep breath in, deep breath out. Now, when you're a mouth breather, right, I had ragweed and I have a lot of allergies, so I have to continually work on my vagus tone. See, it's very hard to slow your breathing down when you're breathing through your mouth. When you're breathing through a much narrow passage like your nose, your breathing rate is lower. So that's one of the ways that nose breathing helps you. So we all should take a deep breath in, deep breath out. Try to lower the amount of breaths we do each minute. And then what that does is it increases the effect of breathing on our heart rate, and our heart rate slows through the vagus nerve. So one of the easiest ways to get the vagus nerve tone up is just with deep breathing. So that's something we all can do. And then another thing we all can do is work on our cervical curve. So please, I'm urging everybody to limit the amount of cell phone use. If you're somebody who's addicted to the cell phone, I'm just telling you, all that stimulation through your eyes and your brain, it's injuring the eye cells, the retina. It's injuring the brain. And you know, most of the things that we see on the internet, they're not loving, caring, kind, beautiful things. All of us should be trying to limit our exposure to the internet to as little as possible. If you do have to look on the computer, I'm just telling you, have it looking up. Have it looking up. When you look up, you increase the strength of your neck muscles, and that will help you get your cervical curve. People, yeah, so just people who have to work on the computer, please get your computer system up so you're working on your neck curve during work. Next. Okay. Top 5 treatments for vagopathy. Prolotherapy and cervical curve correction. Please look up. Try to eat a nutrient-rich food. So I didn't talk about it, but when you eat way too many carbohydrates, when you eat too much sugar, and you get overweight, the term for that is just diabetes, overweight. Excessive blood sugar is terrible for nerves, including the vagus nerve. So just anybody who's overweight, one of the ways you can help your vagal tone is to decrease your body weight. Extra weight is very, very bad for the human body. A simple, balanced life. Try to simplify your life. Try to be outside. Try to be a calm, joyful person. Have a grateful demeanor. Try to make your words be uplifting. Try not to complain. Try not to grumble. Don't be talking about people and they did this and they did that. Try to be a blessing to those. Love your enemies. And then have a healthy breathing lifestyle. Slow, deep breathe through your nose. Now I'm going to take a few questions.
Thank you, Dr. Hauser. We have 4 questions. My DMX shows there's an alar ligament problem.
Yeah.
Can you talk about the alar ligament?
Most DMXs, the way the DMX is programmed, it shows alar ligament injury, but it's actually not there. So the programming's wrong. I've told the inventor that the programming is wrong. So if you've been diagnosed with an alar ligament injury and you didn't get the DMX, digital motion X-ray from us, see, we do some different views than other people. Please send me the scan and I'll see if you really do have an alar ligament injury. If you want to think you might have an alar ligament injury, I would get a MRI, a 3 Tesla MRI with alar cuts. So the normal MRI doesn't see the alar ligament, so you have to get alar cuts. On the DMX, most of the abnormality is because of overhang, like you saw on the digital motion X-ray. That's a capsular ligament injury. So in summary, most digital motion X-rays that show instability at C1, C2, the issue is a capsular ligament injury, which really is treated effectively with prolotherapy. If there's a question of an alar ligament, you have to get confirmation with a MRI, but the MRI has to do alar cuts, so it has to be written that way. Most MRIs are 4 millimeter cuts, alar cuts are 1 millimeter. Okay.
What are the tests that a new patient does at Caring Medical to find if the vagus nerve is involved?
Yeah, like I said, we do a lot of different things. We do a more sophisticated testing procedure than just heart rate variability. So we do, autonomic nervous system testing, but it's a specific kind. Then we do, like we said, we do temperature regulation. Then obviously we do measurements of the vagus nerve. And, there's a lot of people, we have to look at the vascular system. So we have to actually do blood flow tests. So we do ultrasounds, and they're not the standard ultrasounds. We're doing them upright. When you get an ultrasound scan or you get a CT angiogram or MRI angiogram in the hospital, they do them with them laying down. So I don't know about you, but most people don't have a lot of symptoms when they're laying down. They have symptoms when they're sitting up. So we do the testing when you're sitting up and moving. So our tests are dynamic. So we're doing like the autonomic nervous system testing we do. We might subject a person to noise. We might subject them to different positions of the neck. We might subject them. We might even talk to you about the person that gives you stress and just see how your autonomic nervous system changes.
One of the viewers says that this program seems complex and wonders if there are other places that do the same program.
Yeah, no, the program at Caring Medical is actually very unique because, you know, it's a whole specialty in and of itself. And as you know, all you have to do is go on the internet and know that there's just not a lot of people around the country that do C1, C2 prolotherapy, let alone all this stuff. And I've often said the least expensive way for a person to get better who has a complicated neck problem is actually to come to see me at Caring Medical. It just is. It just is. You know, because after 27 years, hopefully I know what I'm talking about. Like I've often said to people that you got to realize I had to have a lot of failures in my career to actually figure out what to do. So, and then anyone who comes to Caring Medical can know it's a lot of employees. Like these are very complicated cases when we talk about like a person's balance is off or mothers who can't care for children, like the whole family's affected. So this is like, we got to get on this, and it's a progressive disorder. So yeah, so I always say the more complicated the symptoms, the more likely it is a person has to come here. Then just know that I am going to start doing phone consults for people from far away to go over their cases before they come here. So again, I'd say go to Hauser at caringmedical.com and start the process of if you wonder if you're a candidate for prolotherapy. And, you know, obviously I'd love to hear about your case. Also, if I did not cover something on the vagus nerve that you absolutely want covered in our second and third part, I'm going to go through the neurology of like the neurology of the stomach, neurology of the kidney, neurology of the vocal cord. So we're going to go into really in depth of the neurology of the vagus nerve and how it innervates and how it gets injured in with cervical instability, and yeah, more detail in the next ones next.
Okay, this is probably the last. What do you think is the incidence of cervical instability in the general population?
Yeah, I would say realize cell phones came on in the late 90s, the year 2000. So you got to realize all the kids, if you have a high school graduate, they have cervical instability. If you have a high school graduate, I'm telling you, you know as well as I do, I did not grow up in the cell phone era. So I was looking up in school. Do you know in school, it used to be you looked at the teacher. Now you're looking down at a tablet. So just know all the kids have cervical instability. I'm telling you that the diseases that you and I get, that we might get in our 70s, our children are going to get them in like the 20s, the 30s. Like, you know, and if you look at sudden infant death, what's sudden infant death syndrome from? Sudden infant death. So if you go on the internet, you'll see that the vagus nerve, they think it's from the vagus nerve. So why is it from the vagus nerve? So anyone who looks at the cell phone for hours and hours, or if you've worked on the computer for hours and hours, you have cervical instability. So it's almost the whole population.
And finally, do you treat C0, C1?
Yeah, I didn't talk about C0, C1. C0, C1 is a lot more stable than C1, C2. Almost all the instability is from C1, C2. So thank you, everybody, for your attention. I look forward to answering your questions at drhauser at caringmedical.com. Please go to our website, caringmedical.com. You can download the book, Curing Chronic Pain with Prolotherapy. Thank you for your attention.